Good afternoon. Thanks for joining us. We're going to start today. Well, first of all, we are all socially distanced here. When you enter the courthouse, everybody wears a mask. For the purpose of communicating with the public, we'll remove our masks so that we can be understood by the cameras. So, Chairman Dolhof is going to lead us off with a statement today.
Good afternoon. I'm Larry Dolhof, Chairman of the Board of Legislators and a resident of the Village of Lyons Falls. Our topic today is the increasing spread of the COVID-19 virus in our county. Until approximately a month ago, with the diligence of our local public health agency, in cooperation with Lewis County Health System and most of the public, we had a limited, controlled impact in our community from the pandemic. Unfortunately, that situation has changed, and not in a good way. The individuals with me today are providing you with the best information and data that we have to date, with the goal to contain the spread and keep us all healthy. This team is comprised of members of our local community who understand the science of a virus and its ability to spread. While there are requirements that are generated from the state, it is our local team, Ashley, Jerry, Ryan, Dr. Harney, and many others who see the direct impacts of the virus in Lewis County. And they are asking you to do your part. Given the increasing number of cases in Lewis County, our employees, both county and hospital, have been working diligently to keep our residents safe. Office of the Aging staff, probation officers, DSS staff, and other county staff are all helping public health with data collection, phone calls, and monitoring. Our nurses, CNAs, and medical staff are treating people with the virus and working diligently to ensure others do not become ill. I really want our residents to realize that their neighbors, friends, and family are working hard to manage this crisis. The next few weeks will be a critical time. As the number of infections rapidly increase in our county, while the cold weather sets in and forces us to move inside, we must change our behavior to bring the number of positive cases down. Mandates and regulations might come from the state, but it is our local staff that is implementing procedures to keep Lewis County residents safe and healthy, and to keep our businesses and schools open. Enforcement of good practices is something we can all be involved in and pay attention to. As a county government, we want to encourage people to do the right thing without the necessity of enforcement actions. As my fellow legislator Randy Lachaux stated in a press conference a few weeks ago, it's everyone's personal responsibility and respect for others that needs to rise to the top at this time. Let us all do the right thing now and for however long it takes to reduce the virus activity in our hometowns. Show respect for public health employees, Lewis County and hospital employees. They are your neighbors and your friends. The county is providing the resources and the information to help our citizens make good decisions. We can only ask all of you to follow this guidance. Stay close to home, wear a mask, social distance, don't have large get-togethers or gatherings, and follow basic personal hygiene practices. If we all work together, we can reduce the spread of the virus and move forward in a positive direction as we look forward to 2021. Thank you.
Whoops. Okay. Thank you, Larry. I think Larry said it right today. This is an invitation. Today we're going to be sharing some additional information with you, some more facts. We're going to present a map later today. But the point is that you have some of the best experts we have in the community, Ashley Waite and Dr. Harney, with us today. They're going to run us through the numbers. They're going to tell us what's going on. That's all we can do. It's up to the citizens to make the right decisions, to make changes in this trend and flatten the curve. Cases since March, as you can see, our total cases at this point sit at 220. However, cases since October 19th are at 149. So more than half of our cases have come within the last month. Right now we have 58 active cases of COVID-19 in Lewis County, and 6 of our community members are in the hospital. We have had 19 hospitalizations since October 19th. We're definitely entering a different phase of the pandemic here in Lewis County with numbers that we have not seen before. And it's critically important that we follow the facts, trust the science, and do the right thing. So for that, we're going to turn to first our Public Health Director, Ashley Waite, that's going to talk in a little more detail about what we know about some of the cases right now.
Thank you, Ryan. So I wanted to tell everybody a little bit about what we're learning about where our cases are coming from. They are coming from larger gatherings that are happening in the community. Family gatherings, Halloween parties, a religious gathering that started the initial cluster that we had here. These gatherings and the positive cases that come out of them reach out into the community and spread. That is why it's so vital that people do not have these gatherings. I also wanted to speak to the fact that we've been hearing a lot in the community, all of these aggressive actions we've been taking with preventing the spread of COVID. Why don't we take that with the flu? A lot of people compare COVID with the flu. But I can tell you, we are still learning about the COVID virus. Yes, it's been around, here since March, but there is a lot to learn yet. And what we do know now is the mortality rate for COVID is higher than that of flu, significantly. In fact, it's currently at 3 to 4%. Now this could change, as we identify more cases throughout the country, where influenza is 0.1%. In a typical flu season, there will be about 60,000 Americans that die from the flu. We've seen over 240,000 individuals die from COVID. So we can't compare COVID with the flu. I do want to speak to the fact that, the majority of our individuals within our community have had mild cold symptoms, flu-like symptoms, but in recent weeks we have seen many individuals that are very ill and requiring a higher level of care, requiring hospitalizations. We are entering flu season. This is a time where hospitals are already busy with individuals that they're treating for the flu or other viruses that tend to circulate in the winter as we enter the colder months. It is critical that we take actions to prevent the spread of this virus so that our healthcare system is not burdened and overrun. We could see situations that they saw in New York City in the spring and that they're seeing in other healthcare settings throughout the country. So that is why we are taking these aggressive actions to prevent the spread of this virus. And with that, I will turn it over to Dr. Harney to speak a bit more about the healthcare system.
Okay. Thank you, Ashley, Ryan, and Mr. Dolhof. I do believe we are, in fact, entering a new phase of the pandemic for Lewis County. To open, I would like to ask my friends and neighbors in the community that I love so much here in Lewis County that you not respond as mainstream media would tend to have you, and that's with fear. I would ask all of my neighbors to, instead of responding with a fearful response, respond with a careful response. Listen to the science and be careful about getting infected yourself, and be careful about spreading virus to your neighbors and family. As far as response from the health system, in conjunction with public health, we have flexed and changed our testing options to try to make testing available to the community as much as we can given our resources. And public health has done a good job at contact tracing and doing rapid quarantine and isolation notices So that has, I think, helped to control the spread in the community. However, now we're in a phase of fairly widespread community transmission of the virus, not isolated to specific events. So all of the citizens of the county have to come together and be careful. The health system has been able to take care of all the patients or arrange for care of all the patients that have come so far. We have seen a significant increase in the use of our services for hospitalization in the last few weeks, but our staff has been able to flex to meet that demand. Our leadership team is reinstating daily incident command type meetings to keep track of the needs that are present on a daily basis. Our medical staff is engaged in trying to make sure that we can provide care to all of the people who need it in our community. And the medical directors of the nursing home, hospital, public health, and along with myself overseeing the outpatient clinics, are working together on a regular basis to try to meet the needs. There is, however, importance in flattening the curve. It's an expression that has been bantered around through this. What it's referencing is the curve of the 1918 influenza epidemic, which shows a slow then fairly rapid logarithmic rise in cases. We absolutely do not want to see a logarithmic rise in cases from where we are now, because that would have the potential to overwhelm our ability to care for everybody who needs care. So I ask for community engagement and response from all of my neighbors here in Lewis County to do their best to limit the spread so that we can together flatten the curve. Together as a community, I believe we can successfully withstand this pandemic, but the key word to that is together. Public health, businesses, the health system, and each and every citizen of our community.
Thanks, Doc. Very well said. As I mentioned before, our goal today is to invite the public to understand the facts as we understand them. And in an effort to do that, we're sharing a new chart today. Doc's talking about logarithmic expansion of the disease. Another way to say that is a curve that doesn't go horizontally but starts to go vertically. And that's exactly what we have right now in Lewis County. Our curve is just about straight up. So doing what we are doing now is not working. So we want to give you one other piece of information here that is new. On our website, you can go to the county website, click on the COVID-19 section. That'll bring you to our COVID homepage, and then you can zoom in to this new map here. So we're showing each active case by township. You can see right now, well, I guess you got to zoom out a little bit to see everybody. There we go. Denmark stands at 18 current cases, Croghan 7, Lowville 11. That is where the majority of the cases are right now in Lewis County. So we're going to be sharing this. We're going to be keeping it up to date every day, along with our new curve. So again, the goal here, we want you guys to know what we know. We have to be very clear. There is not a government solution to flattening this curve. Okay? There is not a healthcare solution to flattening the curve. The only thing that is going to change the amount of cases and the rapidity in which it's expanding is through personal behavior and personal responsibility and personal decision making. We need everybody to understand what the problem is. We need everybody to understand and buy into the science. We need everybody to understand the impact of their decisions. People getting together for parties is not a good decision. People got together for a party, and now Copenhagen Middle School is closed. It's that simple. When people have decisions where they put their own interests and their own pleasure above schools and businesses, that's when we have problems. We have to have everybody in the community recognize that keeping kids in school is a valuable thing. As Lewis County, we value the education that's available to our students. We value people being able to open and run their own businesses. And we're not going to be able to do that. We're not going to have a choice of whether keeping school or business open if the personal behavior and personal decision making of people in Lewis County is not altered to be a little bit more altruistic. Additionally, we are not going to be able to provide enough enforcement. We're not going to be able to enforce our way out of this. Ashley has 20 staff at Public Health. The whole county has 300 staff. This is not going to be a government solution. It's about citizens holding each other accountable. The expectation in Lewis County should be that we wear a mask when we're in public. That's the expectation, and we need to help and hold each other accountable to that. The expectation in Lewis County is that if you are in a situation where you're near other people, you need to be socially distant. That's the expectation in Lewis County. The expectation here is that we wash our hands and that we respect the space of others. These are very simple things. And they're not 100% effective. What we hear a lot with the science is, well, masks can't save you. Okay, but they help. They help. Social distancing helps. These are small measures. They're inexpensive measures that we can take as a community to help keep us safe and to help keep our businesses open and keep our schools open. So that's the message today. We've got more information than ever is available on our website. We will be holding more frequent briefings and have more access to experts. But we need everybody to buy into the fact that if we don't change some of the ways that we're doing things in Lewis County, this graph is going to continue to go up. And the more it goes up, the less freedom we're going to have, because we're not going to have a choice about our schools. We're going to have a choice about our businesses, because Albany's going to make those decisions for us. So with that, we will take questions. And Jerry Cayer is available via Zoom for questions as well.
Do you know how many cases are related to this Halloween party in Copenhagen? Directly?
11.
11. So would you consider this?
And I wouldn't say directly. Remember,
Sorry.
there's
Yeah.
it spreads. Yep.
Are you guys considering this microcluster at this point?
Not at this point.
Are they connected to the church cluster, or?
No.
So it's just not a cluster based on the number of cases at this point?
Clusters are conversations that are happening at the state level in regard to, as the spread continues, what that's going to look like going forward. Because obviously it works when there's just the cluster, but then when there's more community-wide spread, that approach doesn't necessarily work. I mean, we still do case investigation, contact tracing, and try to track it back. But as far as classifying things as clusters, that is something that the state has identified and is currently having conversations with us as to what our next steps will be, what will qualify, and things of that nature.
Okay. So through contact trace, so there would be no exposure alert or anything like that issued for like a party like that, because
There would be if we
you're getting
could.
them through contact tracing?
Right. The only time we do an exposure alert is if we don't have names and phone numbers of individuals to contact
Okay.
where they could have been exposed.
So currently, the only cluster that we identified in Lewis County is still the religious gathering cluster from the Kroger area.
Yes.
Okay. Since October 21st, I think it was, when we were sitting at 71 cases and we're at 220 today, I think you've identified 79 with the cluster.
Mm-hmm.
So that means we have another close to 100 that haven't been associated to any cluster.
Yep.
So what's your understanding of those cases? Is that community spread? Is that
They're from the gatherings and different, various gatherings, some community spread, some from outside of the county or travel associated. And, you know, there's also quite a few that we don't necessarily know where it came from.
Do you guys think as a community Lewis County has learned from the initial religious gathering that we had and all the cases that we saw from there? Do you think that there's been progress made? Do you think that we've learned anything, or do you think that we still have work to do?
I don't know.
I will say that we've certainly learned that the virus is very real. We've learned that just because we're rural and we're small and we don't travel very far doesn't mean that we're isolated from global issues like a pandemic. I don't think, however, that enough people have learned to change their behavior because our cases continue to go up, and that's really the lesson that hopefully we don't have to learn the hard way. You know, we are here today presenting the facts and, you know, just very clear observation that if things don't change, schools and businesses will have to close. So those are the things that people are going to have to decide. You know, what's valuable to them. Is getting your kids to school valuable? Then you need to not go to that party. If going to work at your small business is valuable, then you need to wear a mask when you go to the grocery store. Those are the types of things that we need people to buy into right now.
You put out a call to action last night to church leaders. You were going to do a conference call with them this morning. Could you just kind of go over maybe what was discussed in that call? Were there any specific ask of the church community in the county, or was it more of a just getting them up to date with what the current guidance is and things like that?
Yeah, it's similar to what we've been talking about today. We've been working with the church, the faith leaders as partners in the community. We want them to understand what's happening in the community, and they are leaders in their communities. And so we need them to be part of the solution. And so in order to get there, we have to make sure that they're informed on what's going on. They have an opportunity to ask questions, and they are fully aware of all the current guidance coming in from the state. So I absolutely see the county's relationship with the faith community as a partnership at this point. We've had nothing but wonderful interactions with them, and we're very grateful that they're willing to take some time to speak with us every once in a while.
I'd like to add one thing to your former question about what did we learn from the religious gathering cluster and subsequent. I think the thing that I think as a community we can learn, how is this virus different than the influenza virus? If you imagine that we had a religious gathering a year ago and one person with influenza went to that religious gathering, would we have 79 cases of influenza 2 weeks later? That's how COVID is different. It is a very infectious respiratory virus. It's very transmissible, and I think that the religious gathering makes that very obvious. A very high percentage of people that were at that event left infected.
Good point.
And in terms of that Halloween gathering, do you know how many people were there, if they were social distancing, wearing masks?
I don't know the specifics, no.
As far as so I can't let that presentation go without just saying how happy we are to be able to see. You know that for months and months and months, you know, people have been on us about, you know, how come it's not provided, data by town and things like that. So I think people are going to be very, very happy to be able to see that data, you know, hopefully make informed decisions from that.
I think,
can you just say what led to the delay in the decision of providing that data to people?
no, but I will say this. The map can be misleading. You will see that some of the towns have 0 active cases. Some people in the community will look at that and say, I don't need to do anything in the town of Gregg. I don't need to do anything in the town of Lionsdale. That is absolutely wrong interpretation of this data. So if there is a reason why we've been delayed, it's because our numbers are low, and so there is an opportunity for people to misrepresent what this means, okay? Just because you're in Copenhagen doesn't mean you're the only place that needs to wear a mask and socially distance. That would be an improper interpretation of what we're trying to provide.
Okay. And I think in a smaller geographic area, a smaller county like that, ours, people move from town to town for work and even school and things like that. So just because your town says 0 doesn't mean that there's not people entering and exiting your community that
Absolutely.
might be from the next door town that has more cases.
Mhm.
Yeah.
So in terms of the new guidelines that are rolling out across New York State tonight, the governor kind of left it up to local municipalities to enforce these rules, bars and restaurants closing at 10, things like that. How does Lewis County plan on enforcing those new guidelines?
We plan on enforcing them like we have from the beginning, which is that we have a system in place for receiving complaints and taking action. The first line of defense is for the public to do the right thing. The second line of defense is for the businesses to understand that their licenses are at risk and to do the right thing. And then the third line of defense is for the county, through the county attorney, through the State Department of Health, and through the State Attorney General's office to take action against those businesses that fail to follow the guidelines.
Have there been any updates from, I know that you guys have been following with the state, and the last news conference that we had here, there was still some confusion on how the state designates a cluster area and what our cluster was looking like fitting into the state model or whatever. Have you gotten any further clarification from the state since then? Does it look like, obviously with our trajectory, are we still in danger of being placed in a cluster zone? Or?
So the interesting thing about the cluster model is that the cases across New York State have gone up so quickly that there's many places throughout the state that would be considered clusters, including Lewis County. What we have heard from the state in our conversations is that we continue to have an effective and robust contact tracing effort in Lewis County. In my opinion, I think we're doing a phenomenal job with contact tracing. We do not stop until we find everybody who's been in contact with someone who's positive. And so that has helped us from becoming a cluster. Our testing operation, which we need to talk more about with Dr. Harney, has helped us prevent us from becoming a cluster. We have an unbelievably robust testing capacity set up in Lewis County, and that has helped us. So actions of the community and the community's response matter a great deal in whether you become a cluster or not, and that's one of the reasons that we've avoided it so far. Will we continue to avoid it? That's hard to say. Hard to say. Actually, Jerry, can you talk about testing, because we kind of forgot to leave that out. Go ahead, Doc.
I'll pick that up. Yeah, so over the past few weeks, we have tried to flex and increase availability of testing to the community. We've increased our drive-through state testing program and have had some hurdles to cross with adverse weather and being able to do that in an outdoor environment, which has been quite difficult for the staff. And I commend the staff at the hospital that has helped us with testing. They've been out on cold, driving, rainy days in the parking lot, wet to the core. And we now have a change that will start Monday, November 16th. We will be doing our drive-through COVID community testing through the state program. And that will occur Monday, Wednesday, and Friday from 11 to 1. And it will be occurring at the Maple Ridge Center on the East Road, just up from the new JCC building. Maple Ridge and Beaver Camp have agreed to let us use one of their buildings, so we'll be able to have a drive-through undercover to get our nurses out of the weather. And that's going to be a huge step forward and a great move that we hope to be able to offer right through the winter months for the next 6 months or so. So we're really thankful that Maple Ridge and Beaver Camp has agreed to partner with us on this project and try to accommodate the needs of the community.
Will that be the Abbott rapid test that you guys have currently
No,
been using?
that will be a PCR test that goes to the state lab with results currently running between 36 and 48 hours. You can fairly well count on the results being back in 3 days or approximately 3 days.
Oh.
It's the program that's the state-sponsored program. And through the DOH and the governor's office, we've been an active test site for that program here in Lewis County for a few months now. And that has worked out really well. And that's how we're going to do the testing there. Regarding rapid testing, when you do rapid testing, the manpower requirements are about 3 times increased than when you do the single swab PCR sent to the state, because we then have to enter all the data in the state electronic database. There's a lot more information that we have to collect at the time. There's additional labeling. There's the people to actually do the lab technician function of running the cards, so that those rapid tests like we're up there doing today in the parking lot take a lot of manpower. And I think our resources would be best used to make access frequently to the PCR test. The extra day doesn't make a huge difference in the contact tracing to get the result back. So as long as the state lab can stay in that under 3-day window, that's going to be our primary mode of community testing.
Is the county still being provided with rapid test kits from the state on a regular basis?
I don't believe we've received any additional in the recent past that I'm aware of.
Okay.
They gave us an initial set, then they gave us another shipment that was about 10 days to 2 weeks ago. I do not believe there's a plan to get more of those rapid tests through that program where we got the antigen test.
And I know you're sick of the question we ask at every press conference, but the analyzer that the county or that the hospital purchased back in April, they were waiting on like the reagents and things like that.
Yep.
Is there any update on how that's moving
Jerry,
along?
can you answer that part? You're talking about the CFIT analyzer.
Yeah, I can answer that. Nick, we did receive an initial shipment of test kits and reagents. There were 60, and we've been told we are now in the cycle of delivery, and within the next 2 weeks, we expect another shipment. So we are finally starting to move on that.
Great.
I have one more quick question. So, you know, we're seeing cases from religious gatherings. Halloween was like another holiday. From what we know now, what will happen with Thanksgiving and Christmas? What are your fears with those holidays?
So we encourage people for Thanksgiving to gather with their household, individuals that they live with. And if they're choosing to gather with individuals outside of their household, there is ways in which that could be done safely, maintaining social distance, not sitting all at one table, wearing the mask while in the house as much as possible, gathering outside for a meal, an option, or having windows open, things of that nature. But the bottom line is right now is not a good time for large numbers to come together, and we're encouraging everybody to keep their circles small and stay within their household.
And just looking at the curve and the graphs and where we are, with the COVID pandemic in the community right now. Could either Dr. Harney or Mr. Cayer speak to just what the hospital's preparations are? Obviously, I know you guys have been preparing since March and, you know, stocking up on PPE and things like that, but what's the outlook for the hospital as far as like bed availability and where you stand with PPE and things like that at this point?
Do you want to take that, Jerry, to start with?
Yes. At this point, I think we're in very good stead. Our materials management department, we had set the goal of 120 days worth of PPE inventory. And on any given day, our PAR levels are staying between 90 and 120 days. So we are very secure there, and the deliveries are arriving as expected. With regards to bed capacity, our current bed capacity can handle community need. We also have the capacity, if need be, to double our bed capacity, and we went through that exercise in the spring, and we're able to set up the additional 25 beds, which meant we went from 25 to 50 beds. Now, you know, some of those beds are set up in ward style, which means up to 4 people in a space, but we are able to expand our capacity there. Right now, at this point in time, we have had a number of COVID positive patients admitted into the hospital, and their average length of stay is just about 4 days. And so we've been able to manage that quite well at this point. Let me also address a different question that was raised earlier. This notion of positivity rate. Today, as we do our clinic, we have tested 165 individuals, and our positivity rate for today so far is 6.1%. That is a very high positivity rate. And so as I heard Ashley reflecting on the upcoming Thanksgiving holiday, that is why the public health guidance to keep it to the family unit, make sure there's a lot of fresh air coming in the house, limit exposure to outside individuals outside of your immediate family. When you have a community infection rate of 6.1%, you are at risk. Thank you.
And to add to that, we have great faith in our hospital system and our healthcare system with all the measures that they've put in place. But if we have a graph that continues to go straight up, you know, there's no health system in the world that's going to be able to accommodate, you know, a curve that doesn't flatten at all. Jerry's absolutely right. 6.1% is a very high positivity rate, and unless we can curb that, and unless we can get it down, I don't think it's outside the realm to start talking about how the infections in Lewis County could overwhelm the health system. 50 beds, that's what we have, a maximum capacity, 50 beds. And you've got a curve that right now is 100% vertical. So we have to flatten the curve. It's not a hypothetical like it was last March. Last March it was hypothetical. It was nice. We were all, you know, on board with flattening the curve. Now it's not hypothetical. It's a necessity. So.
Okay, and so just to reiterate one more time, and I think Lexi brought it up too, but as far as just to remind people that the new regulations going into effect at 10 p.m. tonight are the bars and restaurants have to close at 10 p.m., gyms have to close at 10 p.m., and then gatherings at personal residences are supposed to be limited to 10 people or less. Okay, just so everyone has a clear understanding of what's being asked.
Yeah, one note, you can still order for curbside pickup past 10 o'clock. So.
Okay.
Anything else?
I think I'm good.
Okay, thanks guys.
Thank you.
Thank you.